chronic mold or any other type of disease process that's in a chronic phase, I always have them change their diet. Diet is going to
Hmm.
be the most important thing that you can do to get better.
Dr. Pamela Cipriano is a doctorally prepared nurse practitioner and the first nurse practitioner in the state of Connecticut to open a solo practice. She is a board certified acute care nurse practitioner and practices internal and functional medicine. She specializes in chronic Lyme disease and other vector-borne diseases, chronic urinary tract infections, chronic bladder pain, mold toxicity, and candida overgrowth. Today, we're going to focus on mold, fungi, and chronic bladder symptoms, and we've collected a lot of questions from our audience. Before jumping in, I just want to say thank you for sharing your expertise with us.
Well, thank you so much for having me.
Can you tell us a bit about your professional background and how you came to specialize in these areas of health?
Sure. So I was an ICU nurse for years before I went back to school to become a nurse practitioner. And because it was intensive care, I went back to school for acute care. So after graduation, I worked in the Department of Surgery, the Department of Medicine as a hospitalist. I worked as an intensivist in the intensive care unit and in the ER. And I just realized that there were so many areas where if the patients had a really qualified primary care provider, they really wouldn't have ended up in the hospital or the intensive care unit.
Hmm.
And so I ended up leaving the hospital and joined a practice with an elderly physician whose partner had just recently retired. And I took over that side of the practice and realized there was a lot of need for preventative medicine. And so I had found that the vast majority of my patients had pre-diabetes or they were already
Hmm.
diabetic and put them all on an anti-inflammatory diet, which was low in glycemic index. And when I went back for my doctorate degree, it was a retrospective analysis that showed that all of the things that I had proposed and my patients followed actually was statistically significant. So just with diet and lifestyle changes, they were able to reverse the progression from pre-diabetes to diabetes. And outside the research, patients with diabetes reverse the diabetes with just diet and exercise. So it was a good thing for me to see something like that.
Hmm.
I ended up opening my own practice. And at the same time, my son, who had gotten bitten by a tick when he was 6 years old and developed a bullseye rash, had no symptoms whatsoever. But, the pediatrician did put him on some antibiotics. If I have to guess, it was probably about 10 days worth.
Hmm.
About 13 years later, we went scuba diving. He'd been diving since he was 12, and my younger one was diving since he was 10. So this wasn't something new for them. We were in the Bahamas and about 100 feet down, and my 19-year-old developed a lot of abdominal pain. So we went back to
Hmm.
the hotel. I did a quick exam on him, and he had the tiniest hernia that I could feel where the pain was.
Right.
Brought him to his doctor, who felt the same way, but sent him to surgery because he was really in quite a bit of pain. And when they did the surgery, they found his abdominal wall. His abdominal wall looked like Swiss cheese. That's how they described it.
Wow.
So he was 19 years old, very active, nowhere near overweight. In fact, he was almost on almost more underweight than overweight.
Hmm.
And nobody knew why that was occurring. And there's always a trigger when it comes to Lyme or any other tick-borne disease where your immune system is robust enough to keep everything in check. But if you have any type of a trigger, whether it's surgery, a car accident, a death in the family, an illness, it
Hmm.
drops your immune system. And now you have this infection that takes over your body. And that's what happened with him. Right after the surgery, he started with all these very vague symptoms that were progressively worsening. And we had no idea what it was. And he went to see so many different doctors. The poor kid had to learn how to self-catheterize himself because the pain in the bladder was so severe and the inflammation was so severe that he could no longer urinate.
Hmm.
And now we have the doctors telling him it's all in his head. And meanwhile, I am researching and researching and researching everywhere I can find to see what is going on with my child. And he was 29 now, so 10 years later, he was 29 a month before he turned 30. And I found a research article in the Journal of Urology, and the author had written a case study on a gentleman very similar to my son.
Mm-hmm.
symptoms were identical. So I contacted the researcher and he referred me to ILADS, the International Lyme and Associated Disease Society. And that's how I got involved with Lyme disease. And so I went
Mm-hmm.
away for training with Dr. Richard Horowitz, who's a Lyme expert. I joined ILADS and never expected to be a Lyme literate provider. It just kind of happened because you go through
Mm-hmm.
so much training and the learning curve was pretty steep. There were so many different diseases. You really had to understand like one tick in this area can carry anywhere between 14 and 19 different diseases. And I found that my son's issue was because the bladder, working as a reservoir, is where he was holding on to the bacteria.
Mm-hmm.
And treatment was very difficult, especially trying to treat your own child. Like I had other providers involved as well, but it was difficult trying to get him to stay on the medication because every time, every 3 weeks, he would get sicker. And
Mm-hmm.
it was when I was with Dr. Burrascano, and he had said that every 3 weeks the adult spirochetes come out of the biofilm, and so your patients will get sicker every 3 weeks. And it was just like, wow, my poor son. Like he was so understanding of what his body was going through that he knew the
Mm-hmm.
changes every 3 weeks. So it was really tough in the beginning. So he's doing remarkably better now.
Mm-hmm. It's
Um,
good to hear.
anytime anybody does anything, like you get so tired of being a patient where you just want to be a person again, and
Mm-hmm.
you start just eating regular food with sugar in it or alcohol. If there's one little straggler left over, it'll start the process all over again. So now he started doing the IV vitamin C's again and things like that just to try and get rid of some of the inflammation. But I generally keep people on herbs pretty
Mm-hmm.
much for the rest of their lives, which are all very healthy for you anyway. There's nothing that's going to be detrimental to your health. If anything, it would boost your immune system. So that's usually how I treat Lyme and other tick-borne diseases.
Mm-hmm. Well, so I'm glad to hear he's doing better.
Yes, thank you. As far as the bladder goes, I learned a lot about the bladder because of what I went through with him. And
Mm-hmm.
I had also went away for training with Ruth Chris, the nurse practitioner who specializes in chronic urinary tract infections. And because of what I was going through with my son, I really wanted to get as much expertise as possible. And so she really focused more on the bladder, and that's
Mm-hmm.
really how I got him a lot better. So that opened up a whole different type of patient population for me. So now I have a lot of patients with tick-borne diseases, patients with chronic urinary tract infections, interstitial cystitis,
Mm-hmm.
things like that. And interestingly, I haven't had a patient with a chronic urinary tract infection yet that didn't have a tick-borne disease.
That is
Somehow
very
they go
interesting.
hand in hand. Yeah.
Mm-hmm. I think a lot of people in our community ask questions about this because they also suspect something like that might be going on.
Yeah. And anytime you're exposed to mold, if you do have some type of a tick-borne disease, it just makes everything so much worse, almost like on steroids. So if
Mm-hmm.
you're staying in a B&B and it happens to be an older building where there's mold, patients get very toxic very quickly just from being
Mm-hmm.
in that environment. And a lot of times their symptoms will come back so fast and they panic because they feel like they were better. But again, you
Mm-hmm.
just need one little straggler left over to start the process.
Yeah.
So once we get rid of everything, it's a lot easier to catch up.
Yeah.
You know, if anything does get out of hand again, it's a lot easier to kind of reel it in.
Yeah. Well, that seems like a good time to jump into some of the questions. I thought we could start with some basics. So the first one was, what is the difference between mold and fungi?
They're actually both the same. So all mold and all fungi are the same thing. They're interchangeable.
So,
Mold is going to be several different types of mold. But
mm-hmm.
if you think about like a mushroom, for example, it's usually they can be toxic. They could be very healthy, especially like something like lion's mane. That's a fungi, but it's also a
Mm-hmm.
mold.
And what is mold toxicity?
So mold toxicity, and everybody is different. No one is clear from any type of mold. There are certain types of mold that are going to affect you differently. And if you have an underlying issue, or if you have a real allergy to mold, you're going to be affected more than somebody else would. So for me, it was I had thyroid cancer and didn't know it at the time. And that was my underlying thing. And
Mm-hmm.
we were in a moldy area. We were by the shore, and my asthma was never so bad. I could barely
Mm-hmm.
breathe, even with the inhalers. If I didn't have the cancer, I wouldn't have gone through that. So there's always an underlying reason why
Right.
you react so much worse to mold. It's a very tiny spore. It
Hmm.
literally lives almost everywhere. When there's water involved, you can be sure there's going to be mold in the area. Um, Mycotoxins are very similar to the mold exposure that you
Hmm.
get, but that's when people do become very, very ill with mold, with the toxicity.
And can all types of fungi cause that kind of toxicity?
The vast majority can. There's very few fungi that are actually not contributory to the illnesses. But I would say to be on the safe side, I would consider all mold to be dangerous,
Okay.
really just to be on the safe side.
And what is the impact of mold toxicity on the immune system and in particular the bladder?
So for the immune system, any type of mold, bacteria, virus, fungi that gets into the system is going to be reactive to the immune system. And if your immune system it's really robust, you can actually have more symptoms than somebody who has an immune system that's not functioning as well as it should.
Hmm.
Unfortunately, the person who has an immune system that's underacting, the mold has an opportunity to get into lots of different areas in the body. And some of the symptoms are going to be brain fog, profound fatigue, joint pain, very similar. I'm sounding like Lyme disease right now,
Hmm.
very similar. Sometimes it's going to irritate the bladder. So mold can be anywhere in the body, and it can get into your body by so many different areas. It could be inhaled, it can be absorbed through your skin. It can come in through your eyes, your hair follicles. My son was cleaning out a home with mold and had told me that he wore the N95 mask. And I said, okay, did you put the hazmat suit on? Because it affects
Hmm.
everything. And he didn't. And he knows better. And
Hmm.
he started on charcoal. So he's taking 1,200 milligrams of charcoal daily right now as
Hmm.
a binder to try and pull the mold out of his system. So right now he's not symptomatic, and I'm hoping he stays that way.
Yeah, me too. Does mold become part of the microbiome or cause infection directly, or is it more about making you more susceptible to infection?
It's more you're more susceptible to infection because it
Hmm.
really affects the immune system. So whenever you have mold toxicity, you're more prone to other disease processes.
Okay.
And mold itself can cause a host of problems.
Hmm.
And sometimes it's not as easy as just taking charcoal as a binder. And there's other binders that we can try, but sometimes we actually have to do chelation therapy to really pull the mold out of the system.
What is chelation therapy?
So chelation therapy is done intravenously. The chelation therapy I'm talking about. So chelation therapy would be anything that pulls toxins out of the body. I use calcium EDTA. It's an
Hmm.
FDA approved way of pulling things out of the body. What it does is it's given intravenously and then followed by a liter of normal saline. And what it does is it gets into every part of the entire body. And the chelation pulls whatever is in your body literally out. And then we do urine tests afterwards to see exactly what is in the system. And then we
Hmm.
follow it along until those urine tests are normal.
Speaking of testing, how do you diagnose whether mold toxicity is contributing to someone's symptoms?
So the symptoms of mold, like I said, are very, very similar to Lyme disease. When I have a patient who comes in, and I've had patients who come in from it's called a sick house syndrome, where they're either renting a house or they just bought a house or didn't realize that there was mold in the house,
Hmm.
and they're constantly sick, just
Yeah.
constantly sick. It could be simple as like sinus infections, ear infections, and repeated asthma or bronchitis to skin rashes, skin infections, candida outbreaks, urinary tract infections. It can cause diarrhea. I mean, it can be a real systemic issue. So it can go anywhere from something really mild to something much more severe.
And in the home, can you always see or smell mold, or can it be invisible?
It can be invisible. So there's a lot of people who come here where they're testing positive for mold and they're assuring me that they don't have mold in their
Hmm.
house and they don't have mold where they work. So it's
Hmm.
going to be somewhere. The problem is like if you're not really paying attention to the attics, if you're not paying attention to the corners of the basements, or especially like behind drywall where you're not always going to see the
Hmm.
leaks, You always need water to have mold. You can have
Hmm.
mold spores that will stay alive literally forever. Once you add water to it, it turns into active mold. So the mold spore, again, it kind of depends if it's surrounded by dust and it gets airborne, you
Hmm.
can definitely end up with mold problems that way because it gets into the respiratory system
Right.
and like I said, penetrates through your skin and your hair follicles. But it's really when it's mixed with water is when you have the most problems because then it gets into the ductwork.
Hmm.
It is everywhere. There's no way to prevent contamination with mold when you're in a situation like that.
Do you therefore recommend testing in your home environment for molds?
I do. I do. There's a few different environmental companies that you can go through
Okay.
and they send the kit to your house and they'll generally if you're not really sure if you have mold or not, sometimes just using the filter out of your furnace and rubbing it with the swab that they give you and then sending it
Uh-huh.
back to the company will let you know if there's mold or not. Because sometimes you really can't find the mold. It's really difficult. Like I said, especially if it's behind a wall and it's not
Hmm.
bleeding through.
Well, how common do you think mold toxicity is in general?
It's so common. It's so there's nowhere in the world that there's not mold. It's literally everywhere. And so
Hmm.
I think a lot of people, when their immune system just isn't working to capacity, is when they really get affected by the mold. Because your immune system, if it's intact, you might still get affected by the mold, but it's not going to be a profound effect. But
Hmm.
if your immune system is not working properly, that's when you're going to have most of the problems.
And is the immune system piece the reason that someone in the same environment might be fine while someone else is not fine when it comes to mold toxicity?
It is. So it's the immune system. It's any allergies that they may have.
Mm.
It's their past medical history. It's a lot of different things. So where did they grow up? Did they grow up in a mold infested home? That's the first key that they're going to have issues as they get older. A lot of people go to boarding schools. The boarding schools
Hmm.
are old schools. I have a patient right now that goes to a boarding school locally, and her family lives in an entirely different state across the country. And she is having pretty much every symptom,
Mm.
like I said, mold on steroids. The fatigue, the brain fog, the aches and pains, the vomiting, the nausea, the diarrhea, so and she has tick-borne diseases. So we're trying to work with everything with her, which is it's not easy when you're 16 years old to have to deal with something like
Yeah.
this when you're trying to concentrate in school.
Yeah, that's a lot. A lot of people are interested in this topic and how to get diagnosed if they suspect this. And a few people ask questions about a visual contrast test and whether that's something that you ever use and to share your thoughts about it if you have any.
So visual contrast, do you mean like under a microscope type of thing, like a blood draw or
It's a
urine?
visual contrast sensitivity test for vision. So it measures different things as far as I can tell. Tells you if
That
you
I'm
might
not
have symptoms.
that I'm not familiar with. I know that they do that with Lyme disease to see
Hmm.
if the Lyme is actually affecting your vision. I wasn't aware that they do that with mold, but
Hmm.
if it works for Lyme, I can't imagine it wouldn't work for mold. What I generally use is they are laboratories that are not covered by insurance that are going to be the most accurate testing that you're going to get. And if I have a
Hmm.
patient that the mold is really embedded in their epithelial cells or their endothelial cells, what I'll do is liposomal glutathione.
Hmm.
They'll take about 1,000 milligrams a day for a week or two, and then take a really warm bath the night before, and then give a urine the next morning. And that's usually when we'll get a positive mold test. So sometimes I'll find it in the
Interesting.
blood from LabCorp request. Um,
Hmm.
I don't think I've ever really found it in the urine through LabCorp request, but I have had a lot of success with the other laboratories. And there's so many of them that you could use.
Okay, yeah, that is interesting because we do hear from a lot of people that they suspect that fungi of some kind might be contributing to their UTI symptoms, but it's very difficult to do testing that shows that. How
Yep.
common do you think it is that fungi could be contributing to UTI symptoms?
It's extremely common. It's extremely common. So don't forget, the kidneys are used to filter out any toxins in the body, and then
Hmm.
all those toxins go into the bladder, and then we urinate them out. So the bladder is really a reservoir for toxins. And if your immune system is not acting appropriately, or if you have an overabundance of mold or other toxins in your body, it's going to start to eat away at that protective layer
Hmm.
in your bladder. And now we have either bacteria or mold fungi that's actually attaching itself to the bladder wall. And that's something you're not going to find in a standard culture that you
Mm-hmm.
get at a local laboratory. That's something you'd have to do DNA testing with, and that's why I use Microgen DX, because they do the basic culture that you would get at a local lab, plus they do the DNA analysis to see what's embedded in the bladder wall. And that test, I have never had a negative. Never.
Okay.
When a patient is symptomatic, the first phase one might come back negative. Phase two, I always find something to treat.
Okay. And we do hear a lot about candida when it comes to fungi and UTI, but do you think there are other organisms or other fungi that have had research done about them to know if they could be involved in these illnesses?
There's so many fungi that can penetrate the body and get
Mm-hmm.
into the bladder wall. So it's not only candida. There's so many that could be affecting the bladder wall. So when we do that phase two with Microgen DX, it tells you exactly what's affecting it, what type of
Mm-hmm.
fungus is affecting it, and gives you recommendations for treatment.
Okay. And for mold toxicity or fungi, is it necessary to always treat that, or can the body detox on its own if it's removed from the environment?
So for anybody to get treated for mold, regardless of where it is, you have to get rid of the mold in the home. Either
Mm-hmm.
you move out of the house or you have the house professionally cleaned out of all the mold that's
Mm-hmm.
in the house. Once we do that, then we can use a lot of binders to try and get rid of all the mold in the body. Anybody I have who has a chronic infection or chronic mold or any other type of disease process that's in a chronic phase, I always have them change their diet. Diet is going to
Mm-hmm.
be the most important thing that you can do to get better. So sugar is probably the worst thing that we can ever put in our body. It causes a host of health
Mm-hmm.
problems, including decreasing our ability to fight off infection. So the first thing I tell people to do is to stop eating sugar. So I give everyone an anti-inflammatory diet that I put together. Everything's broken down into food groups. Everything is low in glycemic index, and everything decreases the inflammation in the body. Um, but the inflammatory part of it is what really causes a lot of issues, and it's because of the foods that we're eating.
Mm-hmm.
So, I tell people no dairy. Um, Something like kefir might be okay. It's otherwise pronounced as kefir. That might be okay. It depends on the person and where the kefir came from. So
Mm-hmm.
if it was organic, it's usually okay. I'm not a fan of anything dairy myself, just because in the United States, the the cows that we use for milk production, it's not an
Mm-hmm.
organic type of environment. A lot of mucus gets into the milk. It's overly pasteurized, so we don't really get the benefits of the milk. So I'm not a real fan of it. If anything, it just causes inflammation at this point.
Mm-hmm.
Growing
Yeah.
up with my grandmother who came from Italy, we used to drink the raw milk right out of right from the cow,
Mm-hmm.
before all of this technology took place, and didn't seem to cause the issues that we have now in the United States. Our food sources are not the best. Everything here is more about keeping food on shelves for a longer period of time, making a profit, and not so much about the health of the population. So you have to
Right.
really be your own, you have to really make sure what you're choosing to put in your body is the best thing for you.
Mm-hmm. And the topic of diet comes up a lot in our community, and sometimes the questions are around how strict you need to be. So if you're trying to avoid sugar, does that mean you have to avoid fruit as well as processed sugar?
So the fruits I have listed on the anti-inflammatory diet are all berries,
Mm-hmm.
small apples, small pears are fine. They're not very
Mm-hmm.
sweet. Um, when you get into grapes, bananas, oranges, all melons, they're much higher in sugar. So
Mm-hmm.
anybody who's trying to fight an infection, they're trying to decrease the amount of sugar they're taking in, even though it's a natural sugar, I tell them to avoid those
Mm-hmm.
fruits. And if you want to have them once in a great while, that's fine. But generally, the berries are going to be better at antioxidants, and the amount of sugar you get is so minimal. The health benefits really outweigh anything else.
Mm-hmm.
But something like watermelon, there's literally no fiber to it at all, and the vast majority of it, besides the water part, is just sugar.
Yeah. So
And that's going to
others,
just contribute to the mold and everything.
right. And then the other elements of treatment, you mentioned charcoal and chelation. Are there risks or side effects with any of these mold toxicity treatments?
So with chelation, when I do the IV chelation, it can cause sometimes an allergic reaction. So we pre-medicate
Mm-hmm.
people with Benadryl and methylprednisolone.
Mm-hmm.
Um, the patients I've had have been just so sick that the chelation didn't bother them at all. If
Okay.
anything, it actually made them feel a little bit better. But that's one of the side effects. As far as charcoal goes, the only problem with the charcoal is if it's pulling out a lot of toxins, sometimes people can become symptomatic that way. So
Okay.
if that's the case, and I decrease the dose of the charcoal and I have them taking, start off with like one a day and then increase slowly. The only downside of doing any kind of a binder, whether it's bentonite clay or charcoal or diatomaceous earth, is it has to be taken at least 3 hours apart from anything else. So you
Mm-hmm.
have a 6 hour period of time that you can't have any food,
Right.
any supplements, any medication in your system. You could drink water, but anything else you add to your stomach is going to get pulled out by these binders. And we
Mm-hmm.
don't want that getting pulled out. We wanted to focus on the toxins we wanted to get pulled out.
Right.
So that's the only downside of it,
Okay. And while you're doing this type of treatment, could it actually make bladder symptoms worse before they get better?
without a doubt. So whenever we're doing anything, we're manipulating, whether we're killing something off or trying to pull it out, a lot of times inflammation will start. And it's the inflammation that causes the symptoms to worsen. And so, doing everything you can to decrease the inflammation, and again, it's all diet, is going to
Mm-hmm.
be the best thing that you can do for yourself. Water is the most important thing. Not only hydrates you, but flushes out a lot of the toxins. And the vast majority of people do not drink enough water.
Mm-hmm.
The proper amount of water is half of your body weight in ounces of water. So if you weigh 200 pounds, you should be drinking at least 100 ounces of water every single day. If you're drinking caffeinated beverages, you should increase that amount of water because now you're getting dehydrated.
Mm-hmm.
Um, If you're exercising or sweating or working outside, again, increase that amount of water.
Mm-hmm.
And you do get used to drinking that much water. This is my water jug right here.
Yeah, it's a big one.
This is 60 ounces. It comes with me literally everywhere and quite annoying with it. But that way I know that I got at least 60 ounces in. I try and get
Mm-hmm.
between 60 and 70 ounces of water in every day.
Mm-hmm.
I always meet at least 60. I don't always get to the 70, but I
Mm-hmm.
try my best to.
Yeah. Yeah, it does help to have a size water bottle that's appropriate for what you're aiming for.
It
One of the
does.
problems in this space is that patients often find it really difficult to find a clinician that is literate in how to go about testing and treating fungal overgrowth or mold toxicity. Do you have any advice for how to find a clinician that can help?
That's a really difficult question because, if you're a mainstream provider, you really don't know about Lyme disease. You don't know about mold toxicity. You just don't know about it.
Hmm.
And until like the American Medical Association or the CDC starts really discussing these things, it's just not going to happen.
Hmm.
When I first started at ILAS, I think it was 2017 or 2018 was my first conference there. I was just curious because there were about 300 or 400 people there besides myself, and I wanted to know how they got involved with this because
Hmm.
I didn't know the first thing about Lyme disease. Like I knew about as much as everybody else knew. I didn't know anything about mold toxicity, like nothing like that. And just like with the doctors around me, I just asked how you got involved, and it was always a family member. A
Hmm.
family member, it was one person, it was his patient, but it always seems to strike home before you actually are forced to figure out what is going on. And all of a sudden, you're in a realm that you never even knew existed. When I went back to school for functional medicine, that really helped a lot because that really teaches you so much about what we're talking about
Hmm.
now. So I guess the answer would be if you can find a provider who practices functional medicine, they
Okay.
would be the most likely ones that would understand about at least about mold, not necessarily about Lyme disease, because that's an entirely different subject, but at least about mold and mold toxicities.
Hmm. Okay, yeah, that's helpful to think about. And let's talk a little bit about chronic urinary tract infection, because I know that's another area that you specialize in. What is your approach when you first see a patient who has had chronic lower urinary tract symptoms?
So again, I do the microbiome testing because I want to know what bacteria are we dealing with. And a lot of
Hmm.
times when I get patients, they've already done this. They've already actually ordered the test on their own and
Hmm.
they've done the testing, but then they don't know what to do with the results. And then they bring the results to their mainstream provider and they don't know what to do with it either
Hmm.
because it's something that they feel uncomfortable with going by something Microgen DX is sending them because they, first of all, never heard of it. They've
Right.
never heard of phase 2 testing. And a lot of times the bacteria or the fungi that is coming back positive, they've never heard of that either.
Yeah.
So it's a little bit difficult if you don't have some experience behind you to help these patients. But generally, when I have a patient like that, they've already done the microgen testing, and they've already seen their providers, sometimes functional medicine providers, where they've been on a number of antibiotics, and there's really no improvement at
Hmm.
all. And that's when I go into the discussion about biofilms. So biofilms are a um, very strong structure that is very difficult to break down. And it's a hiding place and a place of refuge, really, for bacteria, mold, fungus,
Hmm.
any viruses, things like that, that can survive even if a person is detoxing, if they're doing the charcoal, they're taking antibiotics, they're taking antifungals, they can still survive in that because those medications cannot penetrate that biofilm.
Hmm.
And so now we have to start with biofilm busters. And the biofilm busters I generally will use is either going to be like nattokinase, serrapeptase, or lumbrokinase. And again, that goes with my Lyme training. Um, we use a lot of biofilm busters because with Lyme disease, the bacteria hides in the biofilm.
Hmm.
So there is a researcher, her name is Eva Sappi. She's out of the University of New Haven, and she did all the research on liquid stevia. So she's a botanist by trade,
Hmm.
and she tried different plant extracts to try and break open the biofilm. She actually got silly enough to, it was in a petri dish. She got silly enough to even try like Clorox bleach and gasoline, and like nothing would break open this biofilm.
Hmm.
So then she tried liquid stevia, and she tried it from several different sources. And that's the one that actually broke open the biofilm because
Interesting.
plants in general need to be able to fight off biofilm or they wouldn't survive.
Yeah, that's very interesting. Are there other tests that you use aside from Microgen DX to help analyze the situation?
So yes, so I use doctor's data a lot. Doctor's data I use for mold toxicity
Hmm.
and for heavy metal toxicity. They're great for that. It used to be, what's the name of it? Great. Can't think of it now. Great something, but they sold they sold their laboratory to Mosaic. So I
Hmm.
started using Mosaic now, which is pretty much the same laboratory, and they
Okay.
do the same thing. They do a lot of heavy metal toxins and mold toxicities. So the urine is going to be it's going to be able to tell you if you have mold or anything, but Microgen DX is definitely the lab that I would recommend if you really want to find out how to treat it as well
Aside from the biofilm disruptors, how do you approach treatment of organisms if you find bacteria?
for the urinary tracts.
Hmm.
So once we break open the biofilm, we've already started the antibiotics because if we don't do that,
Okay.
now we have a bunch of bacteria that's floating around in the body, and that's something we don't
Right.
want to do. So generally, what I'll do is D-mannose is something that's fantastic because it's going to help to decrease inflammation, and it's also an antimicrobial.
Hmm.
There's so many different supplements that we can try and decrease the inflammation and fight off the antimicrobials. I'm not a fan of antibiotics if I don't need it, but for somebody who has a chronic urinary tract infection, I always incorporate antibiotics
Hmm.
and antifungals as well. And sometimes people are on an antifungal for quite a while because the bacteria, when you have a disruption in the balance of the body, you need to treat everything.
Hmm.
And on that same subject, the microbiome in the gut is one of the most important things that you can do to keep that healthy, to try and prevent any overgrowth of bacteria or mold. So the microbiome is really the starting place when you're trying to get rid of any type of bacteria. So when you're treating a patient with a chronic urinary tract infection, it's not only the bladder you're looking at, you're like
Hmm.
treating the entire body. So what I'll do is put patients on probiotics.
Hmm.
If they're on antibiotics, even if they're antibiotics from nature, I always have them take it twice a day. And Bifidobacterium has been found to be the bacteria that is the most important to have in your microbiome. As infants, we have a robust amount of Bifidobacterium. Mothers who are breastfeeding are giving their infants a robust amount of bifidobacterium, but then we start eating and we start eating not the healthiest diet. We start
Hmm.
eating, the fun stuff, especially when we're younger, and we start depleting our microbiome of all of the really healthy bacterias. And that's really how the disease process starts. So the neurotransmitters that are used in the brain, your dopamine, serotonin, epinephrine, norepinephrine,
Hmm.
actually is made in the stomach. So if you have a poor microbiome here, you're going to have anxiety, depression, a lot of psychiatric disorders
Hmm.
because you have faulty neurotransmitters being used in the brain. So you have to like treat the entire body to get everything healthy. So it's not, I know, in medicine, we have a urologist and we have a nephrologist and we have a cardiologist and we have a neurologist. It's one body. You have to treat the entire body.
Yeah, and I
So
think
find,
this is often the problem for patients, and that's what they express themselves. They're trying to find someone who'll look at it more holistically. When
mhm.
you do have a course of treatment in place, how long does it usually take for people to feel like their symptoms have resolved?
That really varies. So it depends on how long you've had it for,
Hmm.
and how severe it is. If it's in the bladder wall, it's going to take a lot longer. Um, but generally, I want to say a starting point is a month. I'll start antibiotics, and it's really based on patient symptoms.
Hmm.
The average is probably 3 months on antibiotics. But like I said before, I always incorporate supplements and herbs.
Hmm.
So when I can get them off of the antibiotics, they're going to stay on something that's going to help to decrease the overgrowth of either fungus or bacteria, really for the rest of their lives. And again, these have health benefits. So it's not like an antibiotic that's going to be killing off all bacteria in your body
Hmm.
and causing an overgrowth of fungus now because we're trying to keep everything balanced. These are things that are from nature, so they're not synthetic like the medications are, and the body accepts it a lot easier and a lot better. They don't always work in the acute phase where you have to use
Hmm.
the antibiotics. But I've had patients that really refuse allopathic antibiotics, and so
Hmm.
we will use all supplements and herbs, and they do eventually get better, but it does take a lot longer.
Okay. What about for patients who might have Hannah's lesions? Have you seen that they're also able to resolve their symptoms and their chronic bladder pain?
So they can definitely be so that's because of the inflammation that's formed from. So it's really an irritation of the bladder wall itself. And that's what causes a lot of those lesions to be produced.
Hmm.
So, you know, cranberry juice is a great thing to try and decrease the bacteria, but something like that, you wouldn't want to use that because there's already so much irritation and so much inflammation in the bladder wall that we want to try and do something to suppress it. And that's a balancing act because for you to get rid of the bacteria in the bladder, you have to keep that pH of the urine to at least 6.0 or lower. And that's why I would generally tell people to start something like cranberry juice. But in that
Hmm.
case, I would probably tell people to try apple cider vinegar. So apple cider vinegar isn't going to be as irritating to the bladder wall that like
Okay.
pure cranberry juice is, but it still has the antimicrobial effects and it still helps the bladder the urine in the bladder to stay at that 6.0 or lower pH.
And do you have any recommendations for bladder pain in general, how to manage that while you're recovering?
That's probably the hardest thing that people have to go through
Hmm.
is the pain itself. And that's coming directly from the bladder wall because that mucosal lining is no longer there. And so what we're trying to do is allow the body to decrease the inflammation and allow that mucosal layer to start forming again. And so once we get rid of the bacteria and once we get rid of the inflammation, that's when things are going to start improving
Hmm.
for them. So the bladder pain is it's directly related to the infection itself and what's going on with the bladder wall. That does take a long time
Hmm.
because we can be completely free of any mold, any bacteria, and we could have gotten rid of all of the biofilms, and you can still have that bladder pain. So that's
Hmm.
something that does take some time to go away. And when it's gone, sometimes people don't even realize, oh my God, it's gone. Like they're just so used to having that pain, and then
Hmm.
suddenly it's no longer there. And that's a wonderful feeling for a provider.
Yeah, and it is a strange feeling sometimes to recover. I remember when I recovered from chronic UTI, it was the absence of symptoms that seemed so strange to me after having them for so long. And it was hard to describe to people this absence of
Yes.
symptoms that I was now thinking about all the time because they
Yeah.
weren't there. And it is a different experience that it's hard to relate to if you haven't been through it.
It's very difficult. And when my son was going through this, it was really hard for me to understand the bladder pain he was
Hmm.
experiencing because he had never had a urinary tract infection because guys generally don't get them, but
Mm.
women get them all the time. And I ended up with this urinary tract infection. I don't know if I willed it on myself to try and understand what my son was going through. I honestly don't know, but I've never had a urinary tract infection that took lo a long time to go away, and this
Hmm.
one did. And the bladder pain and the feeling like you have to void was a horrible experience. And I
Hmm.
remember calling him in tears that I finally understood what
Hmm.
he was going through. And it was like he wasn't happy I was sick, but he was so happy that I finally got it.
I can
Because if you
relate to
don't
that.
experience it, you don't know what people are going through.
Yeah.
You really don't. And I don't want to wish anyone sick, but you really do have to experience what your patients are going through to really understand why they are having such symptoms and why they're
Yeah.
so anxious and they're
Hmm.
just trying anything to get relief.
Yeah, it really does help to better understand that impact on their quality of life and how it does impact every area of their life. And I think if you haven't been through it, it's really difficult to have that insight.
I agree. I really do.
So if patients are interested in working with you, how can they get in touch?
So I work at the Practice of Health and Wellness. I'm in Thomaston, Connecticut. You can go on our website, which is
Hmm.
thepracticeofhealthandwellness.com. Our phone number is 860-880-2525, and you can meet us. You can see us on Facebook or on Instagram. And I've been doing a number of podcasts, so I hope you see some of the other podcasts that I've been doing as well.
Great. Well, we'll be sure to add the links to the video description so people can find you more easily. And thank you so
Thank
much
you.
again for sharing your expertise with us.
Thank you so much for having me. This was a pleasure.
Thanks so much for watching. I hope you found this expert video helpful. If you'd like to learn more about this or related topics, be sure to check out our other videos or head over to liveUTIfree.com for related articles. We'll drop some links in the video description. If you like what we're doing on this channel, you can support our work by hitting subscribe here on YouTube, and don't forget to tick the bell so you'll be notified of our future videos. Thanks again for watching, and until next time, keep asking questions and pushing for better solutions.